Grief is such an overpowering emotion, especially after losing someone so close to you. It can take months, years, even decades to get back to normal, if that's even possible after experiencing a significant loss. This podcast was created to help you move through and release the emotions, allowing you to heal the hurt and begin living again. Listen in as I chat with medical professionals, grief workers, and people who have first-hand experience in losing a loved one, what their experience has been, and what they did to help heal themselves and those around them. Life isn't always sunshine and rainbows, but I believe there is always a silver lining if you're willing to look. Welcome to the Release Podcast. Welcome to another episode of Release Grief Podcast. I am here with Adam Yazbeck. I forgot. Did I say it right?
Yeah, it's great.
Swear for me. I usually always do the name pronunciation ahead of time, and I remembered from your wife's episode, but
Perfect.
I'm like, shoot, let me see if I can remember this. Anyway, welcome to the podcast. It's always nice when we have men on here to give their perspective because it's always a little bit different than women. A little bit,
Yeah.
not always, but a little bit. So, welcome to the podcast.
Yeah, thank you. I'm glad to be here.
Awesome. So, this podcast is 100% about grief in multiple various different forms. So, what made you sign up besides your wife twisting your arm?
That's a great question. Yeah, I have been in this process over the last year of trying to figure out how to continue to be in a space that is very traumatic, where there's a lot of grief, a lot of loss, a lot of hardship, and continue to be able to show up in the way that I want to. So, for starters, I am a nurse practitioner in a pediatric ICU at a children's hospital, a large children's hospital in Colorado.
Oh,
And we are a very busy ICU. We have a very high acuity. And so, although we do a really good job taking care of patients, we do have a lot of patients, unfortunately, who do pass away or who have a lot of life limiting or kind of serious incidents that happen to them. And so, part of my job as a provider in an ICU is to help kind of navigate through that process of walking a family through what it means to have either suffered the loss of their child or really
wow.
kind of grasp with what it means moving forward, especially with like motor vehicle accidents or bad traumatic brain injury, what that might mean moving forward for their family, for their child, for themselves. And so I focus on the medicine as a nurse practitioner, but there's a lot of those emotional and kind of more human elements that definitely make their way into those conversations.
Absolutely. As a mother of a daughter that died in a tragic vehicle accident, we didn't go to the hospital. There was nothing like there. There was
Yeah.
no she wasn't taken to the hospital for that. But the process afterward was pretty ho-hum. Like
Mhm.
there was sheriff's department or deputies, whoever is in charge of that came to the house, and she was my stepdaughter, so they came to her mother's house, and my husband and I met over there at their house. And they came and they delivered the news, and they or like gave us some pamphlets, and then they turned around and walked away, and that was all we got.
Yeah.
And so, what processes do you have like there at the children's hospital for these patients when they're doing it? Like, do you have a robust one, or is it
Yeah.
a lot more work, or like what does that look like?
Yeah, so there are a lot of different people who are involved in caring for children who have suffered a big injury or
Mhm.
who are going through a lot of stuff. We have child life specialists that work very closely with either the patient themselves or if there's other children in the family
What is
to help.
that?
Child life specialists, so they're kind of like developmental specialists, but they
Okay.
really are focused on working with children in an environment that's unfamiliar or it might be
Okay.
scary or explaining things that are like at an age appropriate or developmental level
Okay.
to really meet them where they're at. A lot of times we will use their assistance in kind of helping explain to the other children in the family if their sibling is going to
Mm,
pass away or is very, very ill, kind of getting them to understand what's going on with their sister or brother. Um, we do a lot of like stuff with memory making, and they're part of that process, especially if a child's going to pass away. We have our social workers, which are amazing. We have chaplains that are amazing. Like we have a lot of support. We have a palliative care department that's incredible that does a lot of work around kind of anticipatory guidance, goals of care, kind of those sort of discussions as well, if there's time for it. However, if it's the weekend or if it's overnight, it might
Right.
just be me playing all those roles as best I can. And sometimes the first time they're hearing that something's, really bad is happening or that there's nothing that we can do, it's really me or one of the physicians who's having that conversation with the family. And so we don't get training on that. That's not something that is part of
Really?
our medical education. It's not something that we get a lot of kind of work around how to have those conversations or how to best approach them. That's something that sort of comes with just doing the job. I was an emergency nurse before becoming a nurse practitioner in the ICU. And so we had a lot of patients who would come in and we have no relationships with these families and, a lot of babies who die from SIDS who just
Mm.
come in and they're already gone, but we have to try to attempt to resuscitate them. And
Oh,
then we have to
wow.
explain to the family, you know, they're gone.
Mhm.
So a lot of that stuff's really distressing as a healthcare worker. A lot of
Mm.
those situations are really stressful. They're very impactful. And so
Mhm.
part of my journey as being a healthcare provider and healthcare worker has been dealing with that secondary trauma, how to process other people's grief. How do I stay present, stay available, stay connected, continue to have an open heart in a space where I'm continually being exposed to a lot of suffering and trauma.
Right.
So it's been a
How to
journey.
not, like, take that
Yeah.
on yourself and just, like, release it at the end of the day.
Yeah. And so I think, we talk about resilience, we talk about the things that we do to protect ourselves or to help ourselves kind of process that stuff. But again, none of that's part of our education. None of that's part of a training of how to be a healthcare worker in an environment like that. We have a lot of
That's
resources that
wild to me. That is very wild to me because I guess I would think in the healthcare field, like, they would have something more. They would have more, uh, because, like, if you're in a crisis situation, which, the ER is a crisis situation, there's bound to be death. I mean,
yeah,
it's just a natural part of life. Like,
yeah.
I guess I would have just assumed that they would have had a better more? Not better, but more.
Yeah, I mean, you get excellent medical training. You don't get a lot of
Yeah,
human training.
right. That's true, I guess. I guess you need to become a psychology professor first and then go in the medical field, right?
Yeah. So there are resources and they do have
Sure.
teams of people who come to kind of talk after the fact. But I think what's really missing within healthcare largely, and this isn't specific to any
Right.
institution, is just the understanding of what happens to someone on an emotional or even dare I say spiritual level, which I think, we talk about medicine, we talk about the body, we don't talk about spirituality, we don't talk about people's emotional life. We try to kind of silo things a little bit.
Mhm.
I think it gets really messy when we start to think about people's human qualities as a
Yeah.
provider or as a healthcare worker, and we aren't focused on what someone's role is or how to do XYZ protocol. And we're really good at the physiology and the medicine and addressing disease or injury, but when it comes to
Mhm.
someone's personal process, and of course everyone's different, how do you address everyone's unique individual process? But I think there's a lot of work that needs to be done around that, and I think that's probably why we're seeing so much burnout within the healthcare field.
Right.
Is not being adequately addressed.
And do they have, like, procedures and stuff in place? Because 'Cause I'm not familiar with, like, working in ER. I'm not a physician. I'm not any of those things. I don't even play one on TV. But I don't have any of that, knowledge, like, what a day-to-day is for an ER,
Yeah.
ICU practitioner. Like, walk me through, like, what a normal day would consist of.
Yeah, I mean, when I was a nurse in the emergency department, you know, you get sick patients, but a lot of the patients are there for a runny nose or a cough or they have a fever or, so you might be in the room next door and you're dealing with someone who probably has strep throat and you're doing a swab and you're giving their kiddo
Mm,
Tylenol. And then, all of a sudden an ambulance rolls up to the
mm,
ambulance bay and they're dropping off a kid who's not breathing and you run next door to go do CPR and do a code resuscitation. And, they may go well, it may not go well, but it's this high adrenaline, high energy, really stressful situation. If it doesn't go well, then, family shows up and there's all that process of they're going through their loss of a loved one and you're part of it. You're in that space, you're in their energy, you're in that whole environment. And then you have to go back to go discharge the kid with strep throat and they're mad at you because you didn't give their kid Tylenol, half an hour ago. And you just came out of doing CPR on a child who wasn't breathing. And you have
mm,
to kind of self-regulate yourself to be able to meet them in a place of compassion and
right.
understanding that for them, they don't know that the child next door died. Um,
Mhm.
and you're holding that energy in you and you're holding that in your field in
Right.
your in yourself in your emotional body, and you have to just kind of like bury it and move on and do your job and finish your shift. And so you do that for 12 hours, um,
Wow.
and a variety of things are going to happen like that, maybe not quite to that extreme, but you have,
Right.
that's just an example of what a shift might look like, in an emergency department where you do something and you save someone's life and it's this really amazing experience. And then you walk into the next room and someone's yelling at you because their child's waiting for their x-ray to look to see if, they have a broken bone. And, it's, it's just, there's
Sure.
not a lot of global understanding of what might be going on for someone who's in the hospital helping people. Not that I would expect a patient or a family to have that lens, but it's one of the challenges of working in that environment is that you are constantly trying to navigate that space internally, externally.
So does the place you work, and I don't know about like all medical facilities in general, I don't know. Do they have like a protocol for how to decompress after something as traumatic as that? No?
No, no. I mean,
You have
there
to figure
are,
that out on your own.
they're
Okay.
getting better about it. I mean,
Yeah.
they have processes now where they do like a kind of a quick debrief, especially when it's like a code or something like that, where there's more of a formal process around it. But really, it's like, hey, 8 people in the unit were involved in this resuscitation. We don't have time or the staffing for 8 people to go take 30-minute break to go decompress
Right.
and get themselves
That's
back
true.
together and come back to work. So you just have to, maybe get 5 minutes, you know, maybe less, and then you
Right.
go right back into it. And so the ICU is sort of similar in that regard. It's a little bit less chaotic. We have a little bit more understanding of the trajectory of our patients because we know where they're at. But if someone does fall apart or an emergency does happen in the ICU, it's a very similar process where all hands are on deck and then you have to go right back into taking care of the other 12 patients that you're responsible for or whatever's going on that night. So, um, I mean, this is sort of the flow of working in those high stakes, high pressure environments.
So you mentioned that there was like a lot of burnout
Oh yeah.
because of, is it because of the high stress and they don't, there's, I don't want to say that they don't know how to regulate their system, but just like, just the whole nature of the beast, I guess.
Yeah, I mean, I think a lot of people enter healthcare fields, helping fields because they're empathic people, right? They want to help others. They feel that call to be of service. They want to connect to people. They want to help people. They want to,
Mm,
do good in the world. So they're coming in with these really beautiful open hearts with this really noble intention.
mhm,
And I think if you know empaths, you might be one yourself.
mm,
We're really sensitive.
yeah,
We're really wide open, and um, we may or may not learn how to deal with that, and what are our healthy boundaries, or how to have boundaries, or how do
right,
you navigate not taking on other people's stuff, or if you feel it, then how do you let it go? How do you not identify with it so intensely? Um, that's the lifelong process, and I don't think anyone gets a lot of training or understanding or education around who they are as a human and their own little machinery and how that interacts with the space where you are being asked to be constantly exposed to situations where you are going to take on a lot of stuff that's really intense. It's
Right.
really hard.
Yeah, like, how long have you been, a nurse practitioner or involved
Yeah.
in this field?
So, my first career was in acting. So I did theater professionally for like 7 years.
There you go.
And that was wonderful. And I loved that. I transitioned into nursing, about 11 years ago and did that for 5 years as a ED nurse, in like big trauma centers. So very hectic, very intense environments. And then transitioned into a nurse practitioner role in the ICU in 2018. So I've been there now for 6 years. So
Oh,
11
wow.
years total in healthcare. But not coming into it originally. So it's a second
Mhm.
career. And so I have a little bit of a different way of looking at what it is I do, um, and a little bit of a different kind of understanding of what I think is what's acceptable or what I should accept for myself and how I need to navigate that space because I'm not just accepting that it is the way it is and that's the way it is. You
Mhm.
just suck it up and do it. Because I think that's a lot of people's mentality is that this
Right.
is just the nature of the beast, and if you wanna be in healthcare, you just have to have a thick skin and suck it up and, like, do your job, and that's okay. That's sort of what's expected of you.
Is there like a high, maybe a higher, um, like depression rates and stuff with the healthcare facility and
Yeah.
not facility, but like the people that are helping?
Yeah, I don't know the numbers off the top of my head, but I think physicians have one of the highest rates of depression as well as one of the highest rates of suicide in the country.
Oh, wow.
And then there's a lot of, nursing, I think it's like 1 in every 2 or 3 new grad nurses leaves the profession within, like, the first year or 2. Which is insanely high if you think about it.
Yeah.
And then, a lot of people over time will end up leaving bedside or leaving direct patient care and go into more things that are kind of shielded from those environments. So maybe they're more of
Mm.
an education role or they're doing more things that are office or administration and less patient facing. I think that's kind of a natural process is that you get to a point where you can't really do it anymore
Yeah.
because you don't have the skills or the tools to navigate that internal landscape easily anymore. And some
Yeah.
people just do it for the rest of their life, or they're just career physicians, and it's something unique about their own personal
Right.
resiliency or their personal characteristics that they are able to kind of do that. But not everyone has that resource.
Right. I remember being, I was like an aide at a nursing home when I was 17.
Hmm.
And I loved it because I love listening to stories, and of course, it's a nursing home. Everyone in there's got a story, and
Yeah,
it's so fascinating to talk to them, and you meet their family, and you get to know them, but then all of a sudden, they started passing away. I mean, they're older, and they have medical issues and stuff, and my heart broke, and I left the field and never went back.
yeah,
I couldn't handle bonding with them and then losing them. At
yeah,
such, a turnover. And so I completely understand that aspect, but not like in a high emotional one, like a or ER or an ICU or anything like that.
yeah. I think everyone has their own sort of strategy with how they handle it. I think some of them are healthy, some of them are unhealthy.
Right.
I think I came in very open, very, naive, as to what
Mm,
healthcare was gonna look like.
yeah,
I always wanted to do ICU as a nurse. I got my first job in the ED, thought I'd try that out. If I didn't like it, I'd go back to ICU. I loved it as a nurse, and so I did that until I transitioned into my role as a nurse practitioner, but, um there was something about the adrenaline of it. I went
yeah,
from being a theater actor to, that high adrenaline, high energy environment was very familiar to me. Um, and I think I love the medicine, I love the science of it, I loved all those aspects. And I think what I was not anticipating was how much the human aspect of it was going to
right.
stick with me. Those really intense, really hard, really traumatic events, the grief, the sadness, the stress, the anger, a lot of, we get a lot of child abuse cases.
Mm,
Um, sexual assault, stuff like that. Like there's a lot of darkness, and we get
Right.
exposed to all those aspects of humanity. And that was the part of it I don't think I was quite prepared for or knew how to handle. And so I think, like we all do, we get this callus that starts to build up, right? Like we get, we
Yeah.
start to get a thick skin. We start to build this armor as a protection mechanism. And I had an experience where, I was noticing that this was happening, that I was starting to build this armor. It was getting thicker and thicker and thicker and thicker. And I was like, great, I can handle anything, like any gore, any intensity. Like I'm fine. I'm good. Like I got this. And I remember this specific patient where it all kind of fell apart. I had um, this small baby that was probably like 3, 4 months old. It was probably a SIDS case. That came in and brought in from home by an ambulance into our emergency bay, and they weren't breathing, and we were doing CPR in progress, and we were trying to continue CPR until family got there, and we knew we weren't going to get them back because after a certain point it's not
Yeah.
going to happen. But we do CPR to the family, gets there so they can see that we did everything that we tried. So we were doing CPR for a long time, like maybe 30 minutes, and it was probably started before they came. So it was probably like an hour this child, the heart was not beating, if not more, right? And we all knew it was going to happen, but you do it, right? So there's something
Yeah.
that's going on there internally where you're doing something that feels potentially futile to a
Mhm.
child, but you're doing it for the parents. But then it's not a pretty situation. It's stressful. It's very traumatic to be doing that. And then the family shows up, and they were not English speaking. They didn't understand what was going on, and they just wanted to grab their child and hold them.
Mm.
Anytime we have a baby that passes away
Mhm.
with circumstances that are unclear, it becomes a coroner's case, right? There has to be an investigation. We got to make sure there wasn't any foul play. And so really
Mhm.
they're not supposed to like hold or touch their baby.
Touch the baby.
Um, and I had to like, with the help of a social worker who was mostly just there to kind of be a third person in the room, convince the mom to give me her dead baby and put it in my arms.
Mm.
Um, and basically just begging her not to touch her because I didn't want her to get in trouble. She was trying to
Right.
like rub blood back into her face, like bring like
Mhm.
life and warmth back into her physically. But I was worried she was going to create like abrasions on her face that they would
Right.
construe as like abuse, or I didn't, I wanted to protect them in this situation as much as I could. But then like asking her to give me her baby who had, passed away probably hours ago.
Mm.
She finally did. And she gave me the baby and she walked out of the room and I just lost it. I
Yeah.
literally fell apart. Um, I had built this armor up for so long, and it was like the little needle that like finds the hole and goes right into the heart, and it just like the whole thing just crumbled. The whole thing just collapsed. And I had to go back to work. I was the charge nurse. I had to run
Oh,
a busy ED unit.
right.
And take care of the rest of my coworkers while I was not okay. And luckily I had, someone there was just give me a big hug and let me just weep in their arms for 10 minutes. And then we're like, go take a walk. Like, just go take
Yeah.
a walk, and come right back, if you can. So I did. And then I finished my shift. And that was the moment I decided that I'm just going to have a thick skin and that's going to be the way I do this and navigate this wasn't going to work long term. Um, And so I decided to try something different.
Oh man. Yeah.
Yeah.
That would be quite intense. Yes, I remember my cousin lost a child. She was 2 months old to SIDS.
Mhm.
And just I mean, you losing a child. It's a traumatic situation, and the
Yeah.
mothers don't understand the reason why the doctors won't let them touch
Yeah.
their baby. It's their baby. I mean, she's gone. What more can they do? But
Mhm.
if they don't know that there's an investigation going to happen afterward, and all that, because I'm guessing that the baby's pretty fragile
Yeah.
um, at that point. I mean, babies are always fragile, but even more so because any little thing, I'm guessing, will mess with their skin or whatever. Oh man, that's
Yeah.
intense. Yeah.
So, yeah. So I had to go from that, okay, this armor thing isn't working, right? Like I need to try to feel what's happening. I need to like let myself feel things. I'm an empath.
Mhm.
Like I can't, it's not natural for me to be
To
shut
shut it
down
down.
because there's
Yeah.
also this dehumanizing aspect that happens when you stop seeing people as, you know,
Oh,
living, breathing people, right? Like
right.
you try to protect yourself, you try to make it hurt less by, making someone a diagnosis or making someone a set of lab values or making someone, you objectify the situation and you don't see them as a whole person. You see them as their disease or you see them as, XYZ, right?
Right.
Which happens all the time. Like it's part of the way that we speak about our patients. Like, oh, that's the patient with like that's the septic patient, or that's the oncology patient, or that's,
Hmm.
instead of saying, okay, that's, Joey, who's 5 years old, who has Ewing sarcoma. Like, like
Right.
there's this sort of it's sort of natural and it's sort of accepted. It's part of the culture, unfortunately. But I made a conscious decision that I wasn't going to do that. That I was going to try to really like be connected as much as possible,
Hmm.
um, and allow myself to feel what's happening. And so I did that, and that I took on a lot of stuff for many many years. When COVID happened, and that was a really weird time for medicine.
Yeah.
Pediatrics wasn't hit quite like adults were, but we we had a post COVID surge where everyone was like not exposed to normal viruses, and so like everything was like a novel virus for the first time. And so COVID was terrible for the adults. Normal things like RSV that happen every year, kids weren't around for 2 3 years. And so it was like this novel virus called RSV that everyone has had before, but for them they hadn't. It was like their
Right.
COVID. And so pediatrics went through a kind of similar process with normal everyday cold viruses,
Mhm.
that lasted for about a year and a half, 2 years after COVID, really kind of died down. So we had our own little emergency in the pediatric
Right.
world. And what I had noticed over COVID is, I think like everyone did, we were all stuck in our homes. We, weren't
Mhm.
going out. I took up making cocktails and got into like bartending, and so I started drinking a lot more than I had ever did before. I wouldn't say I was an alcoholic, but I was drinking like probably daily, like one or two drinks
Mhm.
a day. Um, I noticed that I was using it as a way to kind of decompress from the day. It was started becoming a crutch. Um,
Yeah.
and so instead of building an armor, I was just numbing out. Um, and so I tried that strategy for a while and noticed that that was not working as well. And so this last year, I've been going through a process of really understanding how to be in a space where I'm going to be continually exposed to difficult things, and how, as much as I can, to not identify with other people's pain, or even my
Mhm.
own pain, really kind of coming up from like a non-dualistic viewpoint. So a lot of like Eastern spirituality, how
Yeah.
to take ego out of the picture,
Hmm.
how to take myself out of the picture, seeing myself as not someone who is doing something for somebody, or I am the person healing the person who needs to be healed, but really just I'm being called into a space. I have accrued this knowledge, and I'm just an instrument for whatever needs to happen. So whatever this person is going to go through, I am part of their journey, and I'm going to do everything that I know how to do and can do. But at the end of the day, whether they get better or whether they don't, it's not my fault if they don't get better. It's also not my success if they get better.
Right.
And so really being more of like a kind of a servant to something higher, and not coming at it from this egoic place of, oh, I'm the healer and you're the person
Hmm.
healing. It's a very different way of looking at it. And in some ways it creates this a little bit of space, between what I'm feeling, the emotion, the pain, and I'm still present with it. But there's
Hmm.
this little layer behind it where I'm not attaching to it. I'm not identified with it. And so it kind of moves through me in a very more easeful fashion, if that makes sense.
100%. That's similar to what I do with the podcast, because these stories come in and sometimes they're heart-wrenching, like with the story with the baby. It's like I can feel all of that, like, as a mother, I feel, like, that mother's pain. I can totally empathize with that without even being in the situation, like, I can feel the high stress, the high energy, the emotions, the torment, um, but then I can also, in the same breath, say, "That's not mine.
Mhm.
It's not mine. That is hers, and she gets, good or bad, they get to have all of it,
Yeah.
and I'm just here to facilitate these stories coming out. That's all I'm doing. It's
Yeah.
not me needing to accumulate stories for myself, but just to give a platform to push it out, almost like a mouthpiece, if that makes sense, like
Absolutely.
a stage, if that makes sense. Um,
Yeah.
and so, yeah, at first I was worried how I was going to feel, because I am empathic, and I can feel energies when they're around me, good and bad, in between, different, whatever. I used to see people when their names were brought up or when they would come towards me, I could see them in colors, like there'd be this hue around them. I would see
Mm.
colors. I don't see that much anymore. Um, but I was worried when I started this podcast how emotionally it was going to impact me.
Yeah.
And so I've developed my own systems for how to do these podcasts. So I do them in big groups.
Mhm.
I'll put a post out and people will sign up for it, and I'll do back to back to back to back to back recordings. And then I'll take a couple months off to decompress,
Yeah.
release,
Yeah. Yeah.
to do things that are not, going to keep me in that high energy state. Um, and then I'll go put a post out and we'll have a bunch more sign up and we'll do back to back to back to back recordings. Some weeks I'm doing, I don't know, 5 or 6 recordings, and some
Yeah.
weeks I'm doing 1, but then but there's a time limit for me.
Yeah.
So I have like, I don't know, 4 weeks where nonstop recording, and then I have like 2 months of non. And so for me that works, but this is a high stress, because I want to be extremely fully present in the moment and hearing the story, and I'm all on the inside, I'm like this, I'm like, "Tell me more. I wanna know more. Tell me more. Tell me more." And so I'm fully invested. I love to hear the stories because I don't know, I love to hear the stories. Like, when I worked at the nursing home with the people, I love to hear about their childhood, their stories, how they navigated life, what they did, everything.
Mhm.
And so this is no different for me. I just wanna hear the stories.
Yeah, there's something in that too, is like and sometimes it's re-traumatizing to go over it over again. It's interesting, like we have, y our coworkers, a lot of us, we're like our own family.
Mhm.
We're almost all trauma bonded together because
Right.
we have the same experiences. A lot of times we've taken care of the same patients. We have those same relationships with the families, and so we build these bonds. We build naturally create these relationships with the
Mhm.
people we're taking care of, and then something might happen, and I might not be on shift that day, and I might want to know, okay, well, this I had this really beautiful relationship with this family, and I wasn't there the day the child passed away, and now
Oh, yeah.
I didn't get closure. And I'm not gonna go reach out to them and, like, stalk them and find them on social media or call them, but it's like
Right.
something almost is incomplete, when those things happen, and so our coworkers who were there then share the stories of what happened, and sometimes that's really healing, but then sometimes that's actually traumatizing for people who weren't part of that situation or didn't have that relationship with them, and they don't wanna hear about, the tragic car accident or whatever that came in that night and how horrible that was for them, and that there's this balance between. I think stories are really powerful. Obviously, I did theater. I know how powerful storytelling is. It was a big
Right.
part of my life for many years, and I still see the power of story, of narrative, both the good and bad, right? Like you have to balance. Okay, well, why am I telling this story? Is this for healing, or am I just saying this because I need to get this off my chest and then not realizing how that affects the people around me? So it's an interesting kind of, you kind of have to balance that one a little bit, in our space. And so I hear what you're saying. Like you want to hear the story, but at the same time, sometimes there's a personal cost to it.
Yeah.
Yeah.
Yes, I agree with that. I agree with that. But people are signing up for the podcast. That's the only reason why I want to hear the story. I'm not coming after
Yeah.
people like, tell me your story.
Yeah, yeah.
Um,
Yeah.
but I have found that the more that I tell my story, the more healing I become,
Yeah.
um, the more healed I am with it. And but again, I'm not in a high emotional situation like that either.
Mhm.
I'm not coming from it. And so I could see where that would be very triggering for some people if they're like, "Oh my gosh, I can't add one more traumatic event to my plate right now. My plate is
Yeah.
pretty full. I've got this one, this one, this one, this one, this one, this one, and I'm tapped out. My bingo card is done. Bingo."
Yep. Yeah. And so, I mean, I'm going back to school right now for my psych mental health nurse practitioner
Okay.
license so that I can help healthcare workers, people who've been impacted by the medical system, either as a patient or a family member of someone who's been a patient, to kind of help unwind these things and kind of take some of the trauma and the stress and a lot of the sting out of these experiences and help people find maybe a different way of
Yeah.
operating in this space and how do we work through this PTSD that we have, the secondary trauma that we've accrued? Like, how do we navigate this space in a healthy way, in a way that's sustaining? So that's sort of my
Mhm.
next journey that I just started this year, and I'm
Well, good for
excited for
you.
that to continue to unravel and explore what that will be for my future. So it's they say like your wound is where your gifts lie, or the wound is where the light comes in. So I'm really taking that to heart and looking at, okay, well, this has been my experience the last 11 years, and this is what I've learned, and I want to really take that and help other people. So
I think that's beautiful, and it's
yeah.
great because, well, we lost our daughter, our 19-year-old daughter. She was my stepdaughter, but I lost her in 2016 to a car wreck.
Mhm.
And then in 2021, I lost a 4-year-old granddaughter to another car
Wow.
wreck.
I'm sorry.
And the it has been a very interesting journey. Um, First of all, I forgot where I was going with all of this. So that's really interesting there. Oh, I remember
Yeah.
now. You mentioned going back in and you mentioned PTSD.
Hmm.
I didn't realize until like 2 years after my granddaughter had passed that I even had PTSD.
Yeah.
So and I only figured that out when I was looking up, I have a private group and I was answering a question and I wanted to make sure that my answer was not, was a good quality answer.
Hmm.
And so, and then I'm I'm reading all the symptoms of PTSD and I'm like, "Oh,
Hmm.
wait, I had that?" 'Cause I had only at
Yeah.
that time applied PTSD to, like, military high stress situations, because my husband is in the military and he was deployed a couple times, and so I'm like, high stress situations, emergency room people, all of this stuff, and I never once equated it to me just having lost a child.
Yeah.
I had worked through the PTSD without realizing that I was doing the steps I needed to go through the PTSD and to not let it trigger me anymore, if that makes sense.
Yeah.
And so
Absolutely.
it was pretty interesting. So I don't think a lot of people realize they have PTSD when they have PTSD.
Yeah, I mean, and what qualifies as the trauma, right? And trauma
Right.
is something that just overwhelms your ability and your system and your way
Mhm.
to of coping with it. So that could look different for everybody, and it doesn't have to be a death, doesn't have to be assault, it
No, it
doesn't
could
have to be
literally be a car
something.
wreck,
Yeah,
like you have a
absolutely.
fender bender with someone,
Yeah.
or I don't know, you trip and fall and break your arm. Like, I mean,
Right. And then the more we're exposed to those repeated incidences, right, our ability to bounce back just gets diminished further and further and further. And so we end up in a state where we have very low resource, very low resiliency, and then something really small happens and all of a sudden it crumbles.
right.
So
Yeah, I'm like, "Whoa, wait."
yeah.
So I'm here self-diagnosing and going through all this stuff, and I'm trying to provide an answer, and I'm like, "Wait, wait, 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 wait. Whoa." So
Yeah.
I began to dive into that journey and stuff as well. So
Yeah, that's
it's just
beautiful.
interesting.
Yeah. So I think, it's like I said, everyone's process is going to be different. And for me, it's really been this mindfulness, and more
Mm,
of a spiritual journey that I've been bringing into my practice. And the way I've been able to show up for people has been really beautiful, since really kind of understanding what my real role here is, and what I'm supposed to be doing in those spaces. It isn't about me fixing somebody else, right? It's
Mm-hmm.
more about me being of service to a situation and seeing other people as really myself, right? Like there's less separation between me and a patient or me and a parent. We're all just humans going through this experience together, and we have our roles to play, and we,
Yeah.
all have a different part in this play that's unfolding, but we're all in it together and we're all walking this journey together.
I love that. That was perfect. Perfect. I am so happy that you came on the podcast, giving me and the listeners a completely different perspective on like the healthcare field, like when we're coming into these traumatic situations. You guys are in them too. Like it's not
Mm,
just me as a parent coming into this situation, like with losing a child or a grandchild or whatever, but you're on the back end coming into this traumatic situation as well with the knowledge and skills that you have, but you still have to process this situation
mhm.
regardless.
Yeah.
Hmm.
I guess I would encourage anyone who's in a situation like that not to worry about the healthcare workers or the providers that are part of that
Right.
process, right? You're having you're
Mhm.
going through something really intense, and our job is to be there to help and support you.
I agree
So
with that.
not to take yourself out of your own experience and worry about
Right.
everybody else. So, and we'll have to do our
No,
own
it's
thing
just
around
like,
it, but yeah,
yeah,
it's,
we all have to pick up the pieces
yeah,
afterward and figure
absolutely,
out
absolutely.
what's what and where's where and
But I think
how
what we
it's how.
I've discovered is that when people are in those extreme states, people are the most open and most human that they probably are ever in their life.
Hmm.
Um, and it's a very beautiful space to meet people in. And so I think if we're all coming from a place of love and coming with a
Yeah,
place of being present and open, that's really where I think a lot of healing happens. Even in really bad, really traumatic, horrible situations, there's a lot of healing that still happens.
that would make sense.
Yeah.
Yeah, I love that. Thank you
Yeah.
again for coming on the podcast. Uh,
Yeah, you're welcome.
so can you drop a bit of advice for someone like a family member coming in, like ways for grief? I know you just mentioned like don't stress about the worker and absolutely that, but can you shift and like so say somebody's listening that is in the high emotional field like healthcare or whatever it
Mhm.
is. What are some steps that you would tell them like how to decompress, how to help themselves at the end of the stressful day?
Yeah, I mean, so being in the ICU, it's usually a marathon. It's not a sprint. And so I always tell people rest. Get as much rest as
Okay.
you can. Take care of yourself as much as you can. You need your own personal resources as
Hmm.
much as they're available to you to kind of continue to be part of this marathon that we're all on. And so whatever people can do for self-care is really important. I think a lot of times, especially when it's your child, right? A parent is going to do everything that they think that they can and push themselves beyond anything that they think that they should call a limit because it's their child. But really, it's to just sort of accept that there are a whole team of people there to help take care of your child, and to really lean on the people who are there to help support you and accept people's help. Um, and do take care of themselves as much as possible,
Yeah.
because it's really hard. It's very stressful. Um, I would probably be a complete monster if my 10-year-old was in the ICU, but
Right.
as much as I can try to encourage other people, to really be patient, um, and to accept people's help.
That's true. People do not like to accept help these days.
No,
Everyone wants to do it themselves. It's my thing, mine, 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 mine.
yeah,
Oh, that's good advice, like, for
yeah.
everyone and just in general. Just in general. Uh,
Yeah.
thank you so much again for being on here. Do you have any links you wanna push out there? Do
I'm
you
not really big on social media. I'm happy to give people I'm on Facebook, I guess. I'm on
Okay,
LinkedIn. People can reach out there and connect if they want to chat some more or have questions or anything like that. Yeah.
okay, perfect.
Perfect.
Thank you again for being on the podcast. It was lovely to chat with you, and,
Yeah.
um, Everyone go ahead, hit the like, subscribe, share, all the things. I can't remember all the things right now at this moment, but thank you so much for listening, and I will see you in the next episode. Bye, everyone. Thank you so much for listening to this special episode of Release. All the links plus a few extras are posted in the show notes below. And if you think someone you know could benefit by listening to this episode, please share it with them. And as always, keep going, keep being, keep doing. You are amazing.